Thank you very much, and thank you for the opportunity to be here today. My name is Oliver Thorne. I'm the Executive Director with the Veterans Transition Network, which is a registered charity that provides transition and mental health counseling programs for veterans across Canada for men and women in English and French. We're also a registered service provider for Veterans Affairs Canada, meaning that Veterans Affairs will cover the cost of veterans who attend our program through their claim with Veterans Affairs. This makes up approximately 25% of the veterans who attend our programs. The remaining veterans, we pay the cost of their attendance through charitable donations. Comme nous sommes un fournisseur de services.
Since we're a bilingual service provider, part of my testimony today will be in French, but unfortunately my French is not very strong, so I'd like to be able to answer all questions in English.
That a Veterans Affairs case manager offered medically assisted dying unprompted to a veteran is deeply, deeply troubling, and it seems to run counter to the entire purpose of the department. C'est un sujet très complexe.
This is a very complex subject, but since I only have a little time, I would like to concentrate on 4 main points that will give my point of view on the subject. First, we are an organization that provides mental health services. So suicide is the worst possible consequence for a veteran suffering from post-traumatic stress disorder. The objective of our program is to prevent suicide by improving the mental health of veterans in transition.
It is an achievable goal because PTSD is a treatable disorder. Leading mental health authorities like the Canadian Mental Health Commission and the American Psychological Association have published countless papers about evidence-informed treatments that are available for PTSD and depression that can reduce symptoms for those who seek them. We also know that PTSD is treatable because of the work that we do on our programs at VTN. Over the past 10 years, we've had 1,500 veterans from across Canada attend our programs, and throughout that time, we've undertaken program evaluation research to measure the impact of those programs on the veterans who attend. Our evaluation shows significant reductions in PTSD, depression, and suicide. In particular, one of our evaluations from 2016 showed that 80% of veterans with frequent suicidal thoughts on day 1 of the program did not have frequent suicidal thoughts at the end of the program and a year and a half later. There are many other programs and services like ours that also provide this type of support. Again, these are treatable disorders and quality of life can be improved. Troisièmement et malheureusement.
Thirdly, and unfortunately, because of military culture, veterans often are reticent to get help. And so often they only ask for help when their suffering has become intolerable, which is why once veterans finally do ask for help, our systems are ready to offer quality services rapidly to help them. And if that's not the case, the risk is that they will completely disengage from the process of seeking help, and they will become more vulnerable as a result.
Add that I think that speaks to the very moving testimony that Mr. Menke provided regarding the challenge of reaching out and asking for help. It is absolutely vital that when veterans make that call, that the system is ready to receive them. Finally, with medical assistance in dying for a mental health disorder becoming available in 2023, we must consider the issue of access, both for MAiD and veteran services. According to the Government of Canada, there is a 90-day assessment period before medical assistant death can be provided. But earlier this year, the Auditor General reported that the median wait time for veterans applying for a disability benefit is 39 weeks, which is 273 days. This means that for veterans who are ill or injured as a result of service, many of them could wait 3 times longer for access to that service than they would for medical assistance in dying. We cannot have a system that offers veterans medically assisted death faster than it offers them access to evidence-informed care that they rightly deserve because of their service to Canada. Thank you for your time. Merci beaucoup.